Okay, so in this video, we're going to be showing how we go through the steps of taking off a temporary crown, putting on a final crown. So right now you can see I'm going in with the hemostats, trying to remove this upper premolar. So we're pulling and we're going to be protecting the lip, so in case that hemostat slips, we don't hit their lip or their tongue. So always make sure that's being protected. We couldn't pull it off, so now we're going to use a spoon instrument and try to go up by the buccal on right along the gum line and try to push it off. So we're going to try to pull it off. We're going to try to push it off, and if that doesn't work, then we're going to slice and kind of break it off, so to speak. So in just a moment, I'm going to get a burr with a handpiece, and you can see I'm going to make a slice here in just a moment, going across from the buccal, across the occlusal to the lingual, kind of separating the mesial half from the distal half, and that's going to make it much easier to break the crown off. So again, kind of going back, if you're going to use the hemostats, that is like trying to hold on to a wet marble. It's we're trying to take off a temporary, so just always be careful with holding the patient's lip or tongue out of the way. Use cotton rolls if need be, just to make sure everything is out of the way. So here we are. I'm cutting away on this temporary. It's just plastic, so it cuts really easily. The water is actually turned off. It makes it easier for me to see. So the assistant just is kind of there in case you just need to kind of suction up any of the dust that comes around. But now you can see I made the slice, and she is now getting this kind of a glorified screwdriver. It's kind of crown separator. We just put that in. Now it just takes and kind of breaks the seal, and I was able to just lift off the mesial and the distal. Now, a lot of times the assistant will come in with a high-speed suction when we're trying to break off a piece, whether it be a temporary, even someone's final crown that has to be cut off for whatever reason, in order to catch any pieces that may fly off when we're trying to break apart a crown. Now we're doing is cleaning off the cement. In our office, we use Duralon, which is a very tough cement to remove. It's great for temporaries because the temporaries don't seem to fall off that often. But when it comes time to clean them off, they can stick a little bit to the teeth, or at least the glue does. So we use a Capitron or a Piezo electric. Either one of those will work. And it's a nice way of quickly removing this. Now, an assistant can do this as far as removing the cement around those teeth. If you're working by yourself, you just take the suction and hang it from the side of the mouth, kind of like the hygienists do when they're in there cleaning teeth. So in this example, you can see the assistant's just kind of sitting there with the suction, just ready to go to pick up all of the different pieces. Not a whole lot more to comment on that. Okay, so I should be wrapping up cleaning here in just a moment, and sometimes we'll just use, hold on a second. See, I'm just sliding that little sleeve. I'm sliding that back over that Profi tip, or that Cavitron tip, because sometimes when we reach over with our hands to pick up something, that little sharp point can be sticking up and you can cut your forearm if you don't cover it. So either take out the Cavitron tip or cover it up. Okay, but going back to the tooth, now I'm just going in and fine-tuning with a scaler, just kind of taking off any extra cement that might be along the gum line. I can tell you that the most typical place that cement will hide out that you won't typically see will be on the distal wall of the tooth. So whenever they're looking, you have to dry it off. That's how you're going to see it really well. You can wash it off, but really get the dryer and dry it off really well to see. Okay, so now we kind of jumped ahead in the video, and at this point the assistant is going to be trying on the crown, making sure that it fits between the teeth. It's going all the way down to the margin, and then it's going to just go around the edges and see. Once we think everything is fitting well, we take an x-ray to verify that there are no open margins on either the mesial or the distal. So she's going to be taking that film right now. You don't have to set the patient up. You can just let them sit like that. Now, if you think that the crown might fall, because remember, it's not glued in at this point. We're just simply trying it on. If you think gravity might be working against you, feel free to have the patient turn their head one way or the other, have them sit upright, if that's going to help. Again, just thinking of safety. So she just took the x-ray and was able to tell if the crown is completely seated. If it's not seated all the way, most doctors would want you to come in or at least want to go get the doctor, and the doctor come in to adjust to make sure that the crown can settle in. Because the only other way to make a crown settle in that's not in all the way, there's only a couple reasons. Either one, not all the cement was off. Two, gum tissue is laying over the margin and unable to allow the crown to seat. Or in most cases, it's because the mesial or distal is too thick and it's getting bound up against the neighboring teeth. So at this point, the temporary is gone. The final crown has been tried in. Everything checks out fine. And we're going to be moving on to actually getting this tooth ready to be cemented. Cleaning out the crown, there's two things that can be done. Either one, you sandblast the interior of it if it's a zirconia crown. or we use this product called Clean, which kind of helps remove any stuff inside of it to make it so that it will stick well. You'll see at this point here, I'm going to come in, check the crown myself. She's holding the crown in place with an instrument while I'm checking with the floss, making sure there's no open contacts and making sure it's not bound too tightly. It looks like in this case, it looks like it was hitting a little bit too heavy. So I'm going in now, I'm going to be adjusting the mesial and the distal. Sorry, I don't have a close-up of that, but just know that's what I'm doing. I'm just allowing this tooth to kind of settle in better so that the flosses the way it should, have the right amount of tension. So I'm going to go back and forth a few times to make sure that this is fitting just right. Again, I'm going to put it in. I'm going to grab the floss. She's going to grab an instrument, hold that in place. I'm going to check the mesial, and then check the distal and the mesial. And if everything looks good, then we will polish it up. Notice when you floss, sometimes the gums will bleed. So we can use a hemostatic agent. We'll usually scrub on the gum tissue and wash it off. This stuff tastes really bad, by the way. But it's a way of helping clean up the gum tissue so that when we seed it, there's a nice clean surface. And again, just kind of more of the same. We're just going back, making sure that the floss tension is just right. Now, of course, whenever we adjust with a burr, whether it be interproximally or adjusting the bite, the crown has to be polished afterwards. So we're going to take that back to the lab and get it polished up. Of course, we're letting the patient take a look to make sure they like it. At this point, we're jumping ahead in the video. The inside of the crown has been sandblasted. It has been cleaned, washed, dried, ready to go. It's sitting off to the side. We're now getting the tooth ready to be glued to. Tooth, of course, has to be free of all saliva, blood, or any kind of debris. So it's a nice, clean surface that we're going to be bonding, or cementing the crown on. So while I'm drying this off, she is now handing me, in just a moment, she's going to be putting some desensitizer, antiseptic agent on a little brush. So she's going to dip that in that antiseptic / desensitizer. She's going to hand it to me. I'm going to go in and start painting the tooth with this desensitizer. Meanwhile, she is measuring out the cement. I'm measuring out now, not several minutes ahead of time. We want it nice and fresh. So I'm applying, I'm drawing. She is mixing. The crown is sitting over there by her. Once she has a good mix, she'll load it into the crown. And then she will bring the crown over for me to just pick up and go straight into the mouth. So as usually the occlusal side is facing up. I'll just pick it up and just go straight in. So there's no fiddling around with trying to make the crown to be in the right orientation. I can just pick it up and go straight into the mouth. Put it in place. Have the patient bite. Yeah, that looks normal. I'll put a cotton roll on their patient. Will then squeeze the cotton roll. While they're squeezing, I'll take a curing light. I'll cure the buccal for 5 to 10 seconds. When the patient opens, that cotton roll needs to come out. There it comes. Sometimes I'll take it out. Sometimes the assistant will take it. I will then cure the lingual side, and this turns this type of cement into kind of a more of a solidified gel state. I'll cure the occlusal as well. And then at this point, I'll go in with a scaler, and maybe the assistant, you would do this, but we would clean off the buccal and the lingual first. It's kind of the easiest spots to get to. And then what's great when you have two people working together is that one of them can hold the crown in place when flossing, so there's no chance of actually popping the crown out. If you were working by yourself, you would pop the floss in, but then pull it out to the side. You would not pull it back occlusally. So here, since she's holding it, I can push the floss up, clean it around, kind of go up and down little strokes, and then I'll just pull it off to the side just because her instrument is in the way. But I'll push again, floss up and down, making sure we're getting any of that excess cement out from underneath the gum line. There, I just kind of pull it over to the side. Clean off all the big chunks, and then just double check to make sure it's all cleaned up. If it looks great, then we'll take one final x-ray just to make sure there's no cement left underneath the gum line. And that's it. That's pretty much it for a crown seat appointment. All right, take care.